Edo State Health Improvement Program, what we call Edo-HIP. This afternoon, the purpose of assembling all of us here is to have a very open and honest conversation about healthcare in Edo State and our aspiration as a government. We have a roadmap. What is our roadmap? Why did we seek office? What have we achieved to date and where are we going? First, let us focus on basic healthcare because that's the foundation on which it all rests. And once we have the foundation right, then we can now begin to build everything on it. Let's identify what we have, the basic healthcare centers. Let's know the state they're in. Let's know the human resources we have. How do we now begin to train and retrain those the people, CHUs and nurses? How do we fix the infrastructure? Because if there's no light, there's no water, there's no security, then nobody will use the facility. Because the emphasis today seems to be much more on secondary care. So when you talk about healthcare system, everybody's talking about hospital, specialist hospital, that seems to be the whole conversation. It's not about the system itself. It's about a few buildings and a few people. We want to shift the thinking from that to a system that works. My hope is that by the time I finish as governor in Edo State, Edo will be a healthcare hub. And to make it happen, we know that government does not have the resources, government alone does not have the resources to. However, government plays a very, very strategic role in pulling, as you will see this afternoon from the experiences of a few, in pulling the resources that we see are available in our system. But the biggest challenge we have in Nigeria is people want to work in isolation. People want to work in cells, and that leads to so much waste. If you're the market woman, if you ask her, because she contributes every day to some kind of savings arrangement, if you ask her to put aside 50 naira every day, just in case she's ill or her children are ill, into a pool, it will be 250 naira a week for a 5-day week. It will be 1,000 naira a month. It will be 12,000 naira a year. If you have 300,000, 400,000 people doing that, you have some money to run a healthcare system. And it is possible. By the end of next year, you will have enough centers, diagnostic centers in the city alone. I know it, as you're going to hear. You'll have at least 5 to 7 centers with MRI machines, CT scans for the basic diagnosis. You'll have at least 10, 12 centers for dialysis. So it is not the money per se, it's the way we organize the system. That is why we have come up with the plan which we call the Edo State Health Improvement Program, Edo-HIP. We want to create a system, an open platform where everybody hooks into. Just like the lady from WHO said, it's a platform where everybody will contribute something to, particularly data, and to also be able to take something out of for their own use or the specific needs along the chain. The world is now driven by data, big data. So the system we used to run in the past, where things were isolated, cannot work as we go into the future. It is open platform. There has to be total transparency. We've got to run open systems, bring law and order, that things be done properly. And that's what the Edo-HIP is about. Let's create some form of order in the healthcare system in Edo State. The institutions, we train them, how we train, how we accredit the institutions, how we set standards. But more importantly, how we ensure productivity. It cannot be a culture of entitlement. Somebody has to pay for your service, right? And health insurance is not going to work if the facilities are not there to provide the service. As your governor, it doesn't matter the obstacles. Doesn't matter the objections. Once you've convinced me like you are that this is the way to go, I will take you there. Our healthcare system in Edo State must be restored to where it should be. That the destination for medical tourism should be Edo. I don't want to see them moving patients and passing through Edo, say they're taking them to Ibadan or Lagos. No, there will be no need to. by this time next year. The health insurance is in place, and I have the pleasure to introduce Dr. Rock Amego as the Director General of the Edo State Health Insurance Agency. The journey has started, and we need the cooperation of each and every one of you to make it a success. But I have no doubts, having worked closely with several of you over the years, that success is certainly our portion.
Wherever those facilities will be, there is need to engage the community. Because every community, whatever they have structure, it could be traditional structure. There is need to get them involved. That will assure the sustainability of such a project. Then on the area of financing, which is extremely important, the presenter actually highlighted that is the big one. How do we ensure that we finance? Because accessibility to health services is a combination of availability in the first place. The facilities are available. The second one that is very important is that, is it affordable? If it is available and it is not affordable, then people are likely going to be excluded. Able to engage the woman who sells in the market, the mechanic, and the farmers to ensure that they are able to finance their healthcare in a manner that it does not strain their resources at once.
We want to launch our health insurance scheme. We want to make sure that within the next 12 months is available. Everybody can go and buy health insurance. For the formal sector, which is civil servants, there's a deduction, there's a counterpart contribution by the state, and it means that anytime you and your loved ones, your spouse and children are ill, they can walk into any facility and receive care and walk out without paying a dime. Edo State was one of the 15 states that was giving some money, 1% of consolidated revenue for primary health care. The fund is available in Edo State's bank accounts. For us to spend it, we need to set up our health insurance to be functional. The fund says that any Edo citizen can walk into any primary health care center, receive a bouquet of services, and the Health Insurance Commission would pay. Coming straight from the federal government, the fund is here. So today, we're having people pay where there's a fund that sits down that allows us to just deduct and pay on their behalf.
So I think manpower is a major problem which we need to look into. Having said that, the area of private sector involvement have not been looked at. You know, we've talked about the teaching hospitals, the primary health care center, which is basic. If you go to India today, about 8% of the hospitals are privately owned that run the healthcare system. I think we've not paid much attention to this group of healthcare professionals. We cannot run an effective healthcare system without tackling the problem of quackery. We must set up adequate laws. Today, anybody does anything, anywhere.
I think, like he said, people should be brought together so that we address duplication. So that whatever WHO is supporting, UNICEF don't support it. Even if UNICEF, the state don't support it. For me, that is one thing that I see is lacking. Because
and people talk and nothing happens, and everybody just goes into self-help. I know I cannot tell you in this hall what I've gone through trying to fix 20 healthcare centers. The amount of corruption, the amount of the people who are supposed to be in charge don't care. You had a situation where you say, go and build a center for me, and the person in charge went to give the contract to a relative who couldn't build. And you have the system that goes on and on and on, and nothing happens. And we all come back and we start talking. Let's all now agree that we should make this thing work, and it's the responsibility of everybody to make it work. You talk about the hospitals, some facilities. Of course, that is part of the problem. How can somebody sit down somewhere, decide to build a hospital, does not inform the state government? I don't know that this hospital is being built. You don't know how you're going to, who is going to work in that hospital. What? I mean, because somebody wants to have a contract and do something for himself. But he needs to train the people that will work there. Have you done a survey of the community and see who, what the requirements are? But somebody wanted to make money and said, go and put the hospital somewhere. We have learned from providing basic education that the communities must be involved, and we believe that we have the experience to make sure it happens. Just to assure you that is it has to be a fundamental part of the primary healthcare provision.